Self-assist, I'll actually get on this side so you can video. Self-assisted means they're going to use another body part. Okay, for the upper extremity, he can clasp his hands like this. Okay, straighten out the arms, and we're going to work on, this is his bad side, this is his good side. So all he's going to do is, remember, active assisted, he's going to try to go up by himself. He has to learn how to just let this one work along with this one. And then when it can't go no more and he has full passive range of motion, now this arm can help a lot. All right? And now we're getting gravity, which is going to be self-assisted also in there. And then you can bring it back on down. Okay, bring it on, it's self-assisted there. Okay, when we're dealing with the low, I'll show one lower extremity. Self-assisted, he can do, well, this is going to be a mechanical. I'm bringing it over for the next one. Self-assisted means he's going to go ahead and bring this up, and he's going to grab his leg, and he's going to go ahead and do this. Okay? And they're working on flexion. It's kind of okay to do, but it's a little difficult because if I wanted his knee straight, he's got to do a lot of reaching. And I don't want him to raise his head up. We want him to be comfortable. But if I just wanted him to do flexion, hip flexion, bend the knee, bring it on up, passive motion, bring it back down to that range. Okay, there's one upper, one lower. So all those forms you did, or that form you did, you're going to do active assisted on all those motions. Okay? And you're going to be teaching him how to do it. Okay? Self-assisted.
Do you have specific ways you want us to do?
This self-assisted is going to be, you gotta play tinker toy. You gotta figure it out. Okay? So main thing about self-assisted is, okay, if I'm going to do my self-assisted, then I'm going to say, okay, start raising your arm. He can't go anymore, so I'm going to help him. You know that when a therapist self-assisted or therapist active assisted is simple. You're doing the work. Self-assisted, because that's what they have to do at home. So I'm pushing more towards self-assisted because they're going to go home. They can do the cradle with shoulder horizontal A, B, and A deduction in this aspect. So I'm using this arm to move that arm. Okay, now the next one is going to be mechanical. Since he's laying there, I can use this little rope.
Can I ask you a question about the self-assisted? Do they have, are we pretending like they have some kind of active movement, or is it going to be they have to do all the way passive movement?
No, this is self-assisted, active assisted range of motion.
Okay.
All right, so this one here is just simple. We just put a band around here. So now I can cover a lot more. He can grab this, and now he can work on bending his knee and then pulling it that way. So we're using something mechanical in this aspect here. All right, because we're using this, it's considered mechanical. All right, now for the upper extremity, which is really the biggest one you're going to be doing, and that's going to be involving a T-bar or a wand. Okay, all you want to do,
No, the weighted sticks are on the wall.
not weighted, just regular like broom handles. I'll find them. There's some.
There's a cane you can use.
Let's just do this. Oh, if anybody has bad IT band, can rub it there. Works great. So basically, he's grabbing something stiff, like this here, and it's just like he's using a mechanical. It's still self-assisted because he's helping this way. So he's going to go ahead and raise on up. The weighted bars are great, but that's resistance. So I can't really use that right now. So this is going to help in regards to that, and then he's going to bring it back down. So the bad arm is going to work by itself, and then he's going to tell himself, help it with this one if he's stuck in a certain range. So this is called a wand or a T-bar. A lot of them, actually I tell patients, go to Lowe's, buy those plastic pipes, PVC pipes, and get a little T-bracket on there and there, because we want to keep the bad arm in this position. This is closed packed, this is closed packed, this is open. So the joint's more free in that aspect. All right, so that takes care of the T-bar or the wand. Wall climbing, actually you can sit up. I'll take Amy over here. No, Skylar, come on, you're not I almost said texting, John, texting. All right, he's just gonna go ahead and walk up the wall. All right, and I can mark with a pen or a sticker or something like that just to see how he's doing, or I could teach him to do that at home. All right, and then he can go ahead and kind of slide down or walk down the wall. So we're doing that, but once again, I want to be in the scapular plane, so he doesn't want to be straight. I'm going to have him this way here. All right, so he's going to walk up the wall. When we start sliding, we're going to have resistance. So we just want to walk up because there's no resistance. It's just active. He's going up as far as he can. He's walking up, and then when he can't go no more, then he's going to walk up with the fingers to help with the full motion, that is. Overhead pulley system. Here we go. You come on with me.
So you hold it. Already, it's fine.
These are kind of nice. These just kind of locks and all that stuff. So she's going to sit here. We'll say with the upper extremity of the shoulder. Okay, grab this here. This is her bat arm. Take this one and reach up in there. So she's going to go ahead and push up. This is going to pick up the slack. When she can't go anymore, then she's going to go ahead and help move it herself. So she's just going to go up and down. So we can do flexion. With scapular wall walking, we can do abduction. We can do horizontal, you know, all that kind of stuff too. Same thing with the wall pulleys here. Okay? Show them one more time. Let's hear you grunt. Right, so it's a nice little thing to do here. So even though she's fighting against gravity, I can actually take this and tie it to a door, and she can do it gravity minimized. But since they're doing active assisted, we want to promote as much against gravity as we can. Okay? Don't let that beat you in the head. I don't want you to have to go to the doctors again. Or I'll have to stretch you out. Okay, that's the wall pulleys. Skateboard and all that stuff is a pain in the rear end because it makes so much noise. But a skateboard is this. And that would be simply, they put it on here. I just did a demo. I could go ahead forward and backwards this way, except I would have it on a board so it slides better. Tara has it right now when you were doing your practice there. So that would be on here, and you can see how much noise it would make. So what we use now is parachutes. God damn it, Brett. Go ahead and take a real quick pee break.